When a child is suffering from trauma, the adults in their lives often seek therapy to help with their healing. And many of those adults are surprised to learn that children can heal through therapeutic playing. Play therapy utilizes play and children's natural abilities for expression to help them express their feelings and work out all those big emotions. National Play Therapy Week kicks off on Sunday, February 6th. And joining us today is Sarah Herrick, a licensed professional counselor for Family Service of Roanoke Valley, to tell us about the importance of play therapy. Good morning. It's always great to see you.
Good morning. It's good to see you too. Thanks for having me.
Yes. So let's break down what exactly is play therapy and how is it different from just simply playing?
Right. So as you said, play therapy is to children what counseling is to adults. So essentially play is children's language and toys are their words. Play therapy uses play, which is children's natural way of communicating, to help them express their feelings more easily through toys rather than words. But it is different from just playing. So although play in and of itself is really important for children, play therapists go through extensive training in order to provide that. And so through play, they're able to help children make sense of their experiences and figure out what's next.
Let's talk a little bit more about in the times, the days in which we're living in, right? So why
Right.
would you say play therapy is especially important as we entered yet this third year of the COVID pandemic?
Right. So, there's more evidence now than ever that kids are struggling with their mental health. The most recent data that I've seen is that at least 1 in 5 children are struggling with their mental health, but about only 20% of those kids are actually getting the services that they need. And kids are facing trauma from everything from abuse, loss of a family member, anxiety about the virus, and that predictably unpredictable routine. And so play therapy and play therapists are really working all over the world to help address this crisis and to help improve children's mental health and overall well-being.
In terms of the issues that you just brought up that play therapy addresses, is there research behind it?
Absolutely, there is. So research findings support the effectiveness for play therapy as the most developmentally appropriate approach to working with children with an array of social, emotional, educational, and behavioral concerns. Kids benefit from play therapy in many ways. So kids struggling with anxiety, with depression, aggression, ADHD, post-traumatic stress, even things like reading difficulty and social withdrawal, low self-esteem and confidence. It really is effective in working with children with a wide array of concerns.
Sarah, share with us how are parents able to use play therapy concepts to strengthen their relationships with their children?
Absolutely. So, parents, I really talk to them about they're the most important adults in their children's lives. So the more that they can engage with kids through their child's language of play, the better. When children have a hard day, they're not going to ask to talk, they're going to ask to play. And so parents can engage with their child in child-directed play, just to enter their child's world through their child's eyes, and allow their child to express themselves at their own pace. And, even just 10 minutes of a parent allowing their child to play while they serve as kind of an active observer, giving words to what they're seeing, can make a significant difference in the relationship that they have with their child.
I know there may be someone that's watching right now and they may be concerned about their child or grandchild or niece, nephew, whomever, and they aren't exactly sure what are the next steps. So when should caregivers or parents seek out help from a play therapist?
Right. So, again, I think a lot of kids are struggling, a lot of families are struggling right now. But if you're seeing things like changes in your child's eating pattern, their sleeping pattern, you're seeing kind of sadness that doesn't go away, that lasts for multiple days, and there's not really a resolve to it. You're seeing changes in their ability to engage with other kids or with you and your family members. Really, just if it's impacting their day to day and their ability to get through the day, or your family's ability to do the things that they have always done, that would be a time I would reach out to a play therapist.
All right. And of course, you guys there are available, Family Service of Roanoke Valley, to assist in that. And if folks want to get in touch with you guys, what's the best way to do so?
Yeah, so they're welcome to just go to our website, fsrv.org, and all the information there about how to get in touch with intake and who to get in contact with is right there.
Well, Sarah, thank you once again for just the wealth of knowledge that you've shared. Such a wonderful resource that we are so grateful to have here in our community. It has been an absolute pleasure to learn from you and your staff over the last 3 years. And so we appreciate you greatly and continue to just be such a beacon of light here in the Roanoke Valley. Thanks.
Well, thank you so much.